his challengers' phony claims are interfering with what should be an honest debate. I'm joined now live from Washington by Democratic Congresswoman Donna of Maryland. And a good morning to you.
Good morning, Alex.
I'm glad you're here. I'm curious to see what happened when you met this week with a group of young Democrats in your district. What did they tell you matters most to them regarding health care reform?
I think people wanted to know the details about the legislation that we're looking at, and it was an amazing discussion that ranged from talking about the public option and trying to understand that, trying to reconcile that with health care that many of them have already. And people were concerned about things like pre-existing conditions and whether, as a small business person or working for a small business, they'd be able to get into the health insurance exchange that would allow them the choice of a public option. And so it was wide-ranging and very detailed.
The public option. So, Representative Edwards, you have the House Majority Leader Steny Hoyer saying this public option may have to be taken off the table in order to get health reform passed. You've got Speaker Pelosi saying that she wants a public option in. How about you? Would you be happy with a health reform plan without a public option?
Well, I think it's really clear that there is a widespread support within the Democratic caucus in our House for the public option, and that we know by the President's own words and by the words of experts that the public option would indeed lower cost, would provide for accountability and transparency, and for real competition in the system that doesn't really have competition now.
I'm curious, do the young Democrats you spoke with, do they understand what you're saying there? Do they understand that?
Well, you know what happened at the Young Democrats meeting is that I had an opportunity in a really, sort of good forum to walk through the details of the legislation and explain it to them. And by the time we were finished, there were some of those young Dems coming up to me saying, now I understand it. I don't understand why it couldn't be explained in plainer language. And I explained it to them as a marketplace, with choice and with competition, sort of like when you go to the grocery store to buy bread and you see all that bread up there and you make a choice, and the public option is one of those choices.
Yeah. Do you think that what you just described is part of the problem? Because you have to go through this thing, walking them through it. These are intelligent people, presumably, who are engaged. They're coming to meet with you, and yet you're having to say, okay, here's the deal. Let me explain it for you. I mean, is that part of the problem?
Well, I think at least part of the issue is that each of us has a different experience with health care. This is not like dealing with other kinds of legislation that's somewhat separated from our lives. Health care, we all feel very differently, and some of us have had really positive experiences and others of us have not. And so it means that we understand our health care and the perspective of our health care in a very different way from other kinds of issues. And it can be complicated. But for people who don't have health care or who are facing skyrocketing premiums and deductibles and co-pays to make it unaffordable for themselves and their families, they want reform and they want change and they want to trust that we're going to do something that really will make a difference in the system.
Have there been any missteps taken by the President and the Democrats trying to communicate their health reform message? If you had a do-over, is there anything you would do differently?
Well, I think one of the things that's really clear is that the opponents to reform, and they are, many of them industry opponents and some of them Republicans who just want to take down a good president, really have mischaracterized so many elements of the legislation. And I think that it's important, it would have been important for us to get out front on that. But I think we have an opportunity now, and we've certainly taken that opportunity over August. I know that I have, to really go throughout my congressional district talking with seniors, with young people who don't have health insurance, with small businesses, to explain the details, and they want to hear it. And so we have a chance to really get this right when we come back in September after the recess.
Okay. Maryland's Democratic Representative Donna Edwards, I want to thank you for your time on MSNBC Saturday. We'll see you again.
Thank you, Alex.
Sure.